So joint replacement is used typically for end-stage arthritis of the joint, and it can be done in the hip, the knee, the shoulder, the ankle. Basically what you're doing is you're removing the worn out, damaged, arthritic joint and you're replacing it so it has smooth articulation and can move freely and does not have the same pain. Patients who have tried physical therapy, over-the-counter pain medications, exercise, and they really just tried to modify everything they're doing and still are having significant pain and can't do what they want to do, joint replacement can be a really big change and really help these people. UW Medicine is a special place and it does provide the highest level of orthopedic care. And I think part of that is that we're all very skilled and we can provide great care for the most complex, challenging cases in the community and throughout the state, but we can also take care of the standard or routine cases at a very high level.